I just joined the elite group of returning 65. And right now, my healthcare is upside down. I finally got it almost under control. What's your feeling on how to correct this? It's heading over a cliff, and no one addressed this tonight.
Yeah, I have a solution for
And
that.
it's a lot of money that this country, and basically the politicians have robbed this fund. And I love it when someone says to me that Medicare is, it's not a, I've contributed to it. You're spending my money without any representation on my end. It's not something that is, it's not an entitlement. It's my money. I own my own business. I match that money that goes in. You know, when it's going to run out. I hope to outlive it.
So I have to tell you, literally, I've been thinking, I've been trying to figure out the healthcare system. And I'm not stupid, and I couldn't figure it out. It's like looking at spaghetti code, and then finally I figured it out, literally yesterday. Literally. So this is, and I can give you a friend of mine, she works for a government agency, she pays $13K into her health, $13,000 a year, okay? She had to have a major head surgery done. Now, she looked at all the people that her plan covers, and it turns out the two best guys that had major malpractice, someone's eyes came out screwed up, and I'm not gonna get into the details, okay? So what does Lorraine do? Lorraine goes, finds the best specialist in New York, who has his own operating theater, his own nurse keeps it immaculate, and pays out of pocket, okay? So basically she's paying $13K and she ended up because she wanted service. Now just follow through with me this way. In the old days, in the 70s, we had a local doctor, and he did a lot of things. You pay like $15, $25. He did this, this, okay? So there's a whole set of things which you can get locally, much more cost effectively. I'm saying 10 cents on the dollar. That burger that hospital makes, all the burgers that they're making, which they sell for $100, or sometimes they say we're going to sell it for $50, it only costs 50 cents. I don't know if you guys know that. They're raping everyone because there is no competition. So the first thing we need to understand is there's a set of services that everyone knows the protocols. Colonoscopy, it's very clear. You do this, then you do this, and then you report. You know what I'm saying? Medicine has done a good job on certain services. If you look at a checklist, they're probably better than a McDonald's burger in terms of what you need to do, in terms of those can be itemized and we can understand the costs. But remember, health insurance companies do not want the cost to go down. So when you look at why are Medicare costs so high, they're high because the entire system doesn't have competition. It's rigged. They want to keep it high, and insurance companies, remember, they make money every year getting more subscribers, scaring you, so they want to keep the costs high. Everyone following me on this? They want the costs high because then you got to get insurance. Let me tell you what the Shiva model looks like. Okay? You have a list of services. Like I pay $800 as an individual per month, so, and I'm pretty healthy. Knock on wood. I do chiropractor adjustments. I work out. $50 copay. Plus, I'm paying whatever another 10 grand over here. This is the future of healthcare. Is that you take a small portion of your money, maybe $100, $200K, $200 a month, maybe even 50. You pay it to the reinsurance companies, like Lloyd's of London, the big guys for catastrophes. Your car, for example, if it gets into a collision, right, you have catastrophic insurance. When you go to the mechanic, are you paying? You're not. That's something you pay out of pocket. So we pay a small amount, $50, $100 a month. Imagine this, and you get catastrophic coverage. And when it's done over a large pool of people, everyone still wins. You follow me? Because if you have 10 million people paying $50 a month, whoever's getting that is getting 500 million a month, and they invest it. And when you work out the actuarial numbers, you have enough to pay for catastrophic situations. So you lower the health cost by separating out the catastrophic piece. Got it? So you pay $50, $100, whatever that number is, and I can calculate it if you want, because I just figured this out. Over here, you have all these services which can happen to you. Your checkup, you need to get a colonoscopy, you pay out of pocket. Pay out, because you know why? Now you're going to shop like my friend Lorraine did. You're going to go, because just like you do with your mechanic, you find good doctors locally. All healthcare is local. It has to be local, because the cost is going down. The people are opening up these surgical centers. Have you seen them? They're basically a room. It has beautifully kept. You as a surgeon, Larry can go there if he's a surgeon, rent the room like Uber. You do it and you leave. It should be Uberized. It may sound crazy, but the technology's there, the infrastructure's there, all local. You pay out of pocket. I'm telling you, it's going to be lower because it's going to be a competitive market. The health insurance companies are getting funded by the hedge funds, which are getting funded by the biggest people we know. They're in it. Go look at every of these politicians. They all have some investment in their portfolio in a major health insurance company. They need that insurance to go up and up and up in price. You follow what I'm saying?
Well, you have the bubble that's up there. The problem is that I'm the tail end of the baby boom.
Yeah.
All right? As someone else mentioned, that you let air out of the bubble, it's gonna hurt.
But I'm
Well,
saying
the thing
you-
is, one of the largest parts of the population, and I'm in healthcare field.
What's your name, by
Largest
the way?
part of, pardon?
What's your name?
Tom.
So Tom, what I'm saying, if you look at you and you combine what you said, is we need to start teaching people how to take care of their bodies.
This is true, but we have this bubble that has to be shrunk. And we have a system that has been raped for years by the politicians.
Yeah.
All right, it was not supposed to be touched, again. What do we do for that little bubble of, I know, I'm gonna be in that 10-year bubble and I'm gonna have my dirt now.
Yeah, so what I'm saying is, the first thing we have to understand is the amount that we're paying into this is overinflated.
Oh, definitely.
Number one,
Everything is
because of the
profiled
costs.
on Medicare.
The costs are high. So these guys, left and right, we're talking about Obamacare repeal. Trump is right, we need to trash the whole thing.
Correct.
It's completely garbage. We need a complete revolution in this. It needs to be thrown in the dustbins of history. We need to take a clean sheet of paper and go to the model I'm saying. People need to just start going to the model where they pay out of pocket for their services, they reclaim everything that they put in, it should come back to them, and they should have the right to do. That's what I'm gonna fight for. You see,
That's
every
where I
day
wanna
that Trump
change.
is in office, it's not whether he passes a bill, but it's a win for all of us because he's a disruptor. He dropped a bomb like a shot that was fired in Lexington. Now you have people like me coming in, who are, gonna think this through, but fight vigorously against this. So that's what I'm gonna fight for. We need to trash the whole thing. It's a complete scam. Obama and Romney were the front-end sales guys for creating big pharma, for creating big hospitals. Look at the record profits. They made record profits, these guys. Record profits. We are basically being taxed. That's what's really going on. Medicare, the things that are taxed, we should take our own money, go on a nice vacation to a spa, go see a naturopath, and I guarantee you your health will be far more, and then have the catastrophic piece. Over here, a bucket where you get to allot your money to take care of your body like you do your car. And over here, collision insurance, okay? $1,000 a year. That's the solution.